morning.
Must be very keen.
Come on in and have a seat. How are you doing?
Not so bad, thank you.
That's a grand one. Just came in cough.
Just need something just to calm me down.
Okay.
It's like I'm just going crazy.
It's a really funny smell as well, like blurred and a little bit past.
Okay, from here, yeah?
Yeah.
Every so often, it's not every week, but every so often I just black out.
Look at yourself and go, do you want to live longer? Yeah? It's as simple as that, really. You need to confront it, but fundamentally it's...
In fact, that's even more dangerous to inject around that tendon, because if that degenerates the tendon and it snaps, you don't walk anymore, and I get thrown off the register.
Good morning, Final Row Surgery. Margaret speaking. How can I help?
What are we doing for you today?
I'm just fed up with everything, to be honest.
Why is that?
I'm taking about 6 Laxodol a day per my constipate. But as you can see,
You're a bit bloated, aren't you?
it's like this.
Oh, dear.
It'll ease, and then the next day I'm back in the same position.
Let me just pop you up here to feel your tummy.
Yeah.
Because we might have to give you something extra to try and get you going. Because they're obviously a bit sluggish, your bowels.
Oh yeah, the doctor said with all the scar, because I've had 4 operations in and out.
That's not any help.
And he said the scarring doesn't help.
No, exactly. The sort of scarring tends to sort of close over the bowels and doesn't allow them to... Well, that's a grand one.
Yeah.
Have a nice big hernia there, haven't you?
I got another hernia here as well, which is popping out more often as well.
Right. Can you just undo this a minute?
I'm fit as a fiddle.
Can you just undo the belt and let me just have a little feel down here? Just give me a cough. Oh yeah, you can see that. That's
got that one. I got a little lump on my testicle as well.
Oh, have you? You're full of things today.
Yeah, while I remember.
We're outside, okay.
That side, yeah.
Okay. Let me just have a little feel. That's okay.
Well, not a lump, it just looks like it's... If you can...
Yeah, no, you're good. That's called your epididymis. It's supposed to be there. I think
that's right then.
Tiny little system there, that's fine.
It doesn't hurt or anything.
No, that's good. There's nothing else to feel. But...
No.
Let me come, mate.
How you doing?
I'm all right. Come and take a seat. Right, what am I doing for you today?
I speak to Dr. Hader and Dr. Lee. You forward with you because my pain is mine.
In your foot?
Yeah, yeah.
Okay. So this is all related to your Achilles tendon coming into your calcaneum. Okay, let's take this off.
Okay. They say Dr. Ward gives you a steroid injection.
Dr. Ward will not inject that.
I don't know.
There's a different thing under here, which sometimes I used to inject, but these days we've decided it's more dangerous because you can snap tendons after doing it.
All right.
And actually, it does nothing for anything up here.
Yeah.
Okay, so this.
Yeah.
So here is your calf muscle.
Okay.
Comes down. Calf muscles. There's a number of them.
Okay.
They turn into your big Achilles tendon. Okay, which is here, and that's all right.
Okay.
And then it inserts into that bit of the heel where it's sore. That's it.
Yeah.
So it's a tendonitis as it goes into there, and I should imagine that stretches it up, but does that hurt it when you do that?
Yeah.
Yeah, okay. You need progressive physiotherapy to try and help that, okay?
All right.
So pop that back on. Put your sock on. So you don't need an injection from me, you need some physio, because there is specific physio for tendons, okay? And it involves some strange things where you're literally stretching that tendon up while standing on some stairs and dropping your heel below the size of the stairs and doing that over and over again, and then putting a backpack full of bricks on and doing it as well to try and do that. So that's what I need to do for you, mate.
All right.
There's nothing to inject there. In fact, that's even more dangerous to inject around that tendon, because if that degenerates the tendon and it snaps, then A, you don't walk anymore, and B, I get thrown off the register.
No, I don't want to do that.
So that's important, but it's an Achilles tendonitis. I'm going to write a referral to the physios, yeah?
Okay, thank you, Dr. Watt.
Good to see you, mate. Bye-bye.
Do them up, and then what I'm going to do, I'm going to give you something that you sort of have to put up the tail end
Yeah, that's fine.
to try and make sure that things start to go from that end.
Yeah.
So as well as tackling it from above, we'll tackle it from below.
Yeah.
Now, for the laxative,
When I do go, it is
Yeah.
quite loose.
yeah,
It's not a case of being
it's just getting a
solid,
bit stuck, isn't it?
but it's getting stuck up in there.
Yeah. Are you drinking plenty of fluids to
Yeah.
make them?
I drink.
Okay. Because if you
Cold
don't,
water
then
from
the
the fridge all day.
Laxidol and the Fibogel don't work as well if you don't sort of use them.
Yeah.
Okay. That's.
And I have about 20 cups of tea a day.
Yeah. Okay. Now it's little sort of mini enemas that you just stick up the back of
Yeah,
the
I've had them before.
Fine. So what I would suggest is one in the morning, one at night to make sure you're going. Once you're going, then we'll
Yeah.
get things sorted then. Okay.
That's great, yeah.
Then once it's settled, just use them intermittently when you need to, and keep using your Laxidol and using your Fibogel in
Yeah.
between times.
Yeah.
Okay.
Yeah, because I eat all, prunes and,
I think when you've a problem like constipation, you do everything you can
Yeah.
because it does make you feel unwell
No.
for such a
Yeah,
sort of simple medical problem to go wrong, but it's a huge
it
effect.
just gets me down.
Yeah.
Okay then.
Okay.
Yeah.
Right.
Yeah.
Look after yourself.
Yeah, thank you.
Take care. Bye bye. Bye.
My sister, she just had a little baby, bless her.
Oh, how lovely. What did she have?
She had a little boy, and I was her birthing partner.
Oh, excellent.
I was, and it was very...
It's amazing, isn't it?
It is amazing, but I probably saw too much of what I should have seen.
Come through. Okay, how can I help?
So for the past couple of days, I've had like horrendous back pain. And I get the fact that I'm pregnant, but it's like really sharp, like in my back. And so much pressure down here as well. But it's my upper back as well, like, and I'm being sick.
Last month you were given some antibiotics for urine infection, is that right?
Yeah, I went to the walk-in centre and
Yeah.
they said that like it could have been like a kidney infection.
Is this your first ever pregnancy?
Yeah.
It does affect different women in different ways, and it's really hard to compare. You're quite tall, so some would argue, you've got the stature to hopefully absorb the increasing size, but that doesn't always fit.
Yeah.
Your hips are being pushed because of the baby getting bigger. That can cause trouble for some women, so it's difficult to say. Now, can I examine you, if that's all right?
Yeah. Do you want me to
I'll work around you here. So whereabouts does it hurt the most?
It's like here.
Okay, in this area. Can you pop on this couch? Just have a look at your tummy. And you feel your tummy's growing regularly?
Yeah.
If you sit up for me, and then if I just feel down your back again. Is there any pain here?
It's uncomfortable, yeah.
Right, so what I will do is ask you, if possible, to do a urine sample.
Yeah. I've just been to the wee and I've just wiped them and like bleeding.
Oh, it started raining? Oh, yeah.
Looks like there's a bit more rain out there, doesn't it?
Well, yeah.
My hands are cold.
Well, it's a cold day up there.
We feel a bit cold. Sometimes it can be triggered by cold weather, so whether that's had anything to do with it, I'm not sure.
Because I want to go on holiday.
Where are you planning to go?
Somewhere warm.
How have you been enjoying this weather?
Loving it.
Good, good.
Loving it.
Soaking up all the vitamin D.
I've just been to the wee and I've just wiped them and like bleeding.
Okay.
So
Is it more than you've noticed before?
not really, like before I was bleeding a lot more heavy, but
When you
I
went to the
literally
hospital?
just started bleeding
Okay.
around, so
Right. I'm just going to dipstick your urine. Interestingly, it didn't really there's just a few spots of blood on here, but you've actually seen some blood on wiping. Okay. Do you mind getting back onto the couch so that I'll just listen to your baby? So how many weeks are you at the moment?
22.
Okay. So beating away, which is good. Brilliant. Okay. So that's reassuring.
Yeah.
But obviously, if things develop with the bleeding side and it's getting heavier, or severe pain in your tummy, then I think we'll need to get you seen at the fetal assessment unit again. All right. If a pregnant woman sees blood in the urine, it is very important that they consult a clinician as soon as possible. Blood can be from a number of places in pregnancy, and obviously the priority is to make sure it's not from the womb itself. But if it's just in the urine, then it's important to make sure that there's no urine infection, or there are other causes that are increased during pregnancy, such as kidney stones. Having assessed you, I think there are a couple of things. You may well have your general aches from being pregnant, but it's very specific that you're tender on the right side. More or less in the loin. Now, I need to make sure, because the risk of urine infection is a bit higher in pregnancy, that although you had a test nearly 4 weeks ago and it was clear, when we sent it to the lab, I'm planning to send this again. Did you have any antibiotics in the last few weeks?
I had cephalexin.
Okay. It may not be a urine infection, but as a precaution, I can give you some antibiotics. My temptation would be to give you like amoxicillin, which can be used in pregnancy. But for your pain, that's the slightly trickier issue. With the general aches and pains, the paracetamol is the favoured option. I think at this moment in time, let's focus on making sure you don't have an infection. Make sure baby's happy, and we've checked from the heart rates, things seem okay. But if you get any extra bleeding or severe pain, seek attention. But otherwise, if things are still like this and your urine comes back negative, then it probably will be related to your pelvic muscles, and you can get something called pelvic dysfunction with pregnancy, and that can be something that will develop. So physiotherapy may be needed, but we can talk about that later. All right? Okay, there's enough there. 3 times a day for 5 days. All right?
Thank you.
Take care. Bye-bye.
It'll be about 5-10 minutes for you, all right?
You're a big help, thank you very much.
You're more than welcome, sir.
There's always a warmth and a smile here with all the staff. They're all very good.
That's what we like to deliver.
Yeah, well.
Service with a smile.
Unless it's because I look the real aim, poor old sod. I don't feel that at all.
No, not at all. You don't look it either. Have a lovely day, sir. Bye-bye.
There you go. Come in, come in. Can you squeeze through? Right. Now then, how did you get on with the acupuncture last time?
I mean, same pain as it.
So shall we give it another try and see if you get any relief with the acupuncture?
Yeah.
Do you want to slip that stuff off, and I'll just get some pins ready then, and we'll do both sides for you. Good. So pain. Let's see what we can do. Just relax for me here. I'm going to put one up in here. I've known Shahid for about 15 years, treating him with acupuncture for his pain in his arms. He's an ex-policeman who had a road traffic accident in the mid-80s, and as a result of that became paralysed and has only got limited movement of his arms and no movement in his legs. There we go.
Oh, my bad.
Do you want to do that? Yeah, no, you take it.
Hello? Who's speaking? Thank you. All right, thank you. Bye-bye. Bye.
Okay.
This was my wife's.
Yeah. Yes, it's not been good for you, has it, really? And that sort of having to look after her. Shahid's life has become even more difficult because not only is he paralysed, his wife had a stroke. As a result of that, she is also wheelchair-bound, and he has now become a carer, where she had cared for him previously. And are you coping with sort of looking after her, or is it just a bit of a big struggle and too much for you, or?
Yeah, it is too much struggle because although she's got the gears, but we don't have much of time. Time slots very less.
Mood-wise, do you feel okay? Are you bearing up sort of mentally, do you think? Because you're a strong chap, I know, but it puts a lot of pressure on you.
Yeah, because, once I had a disability, so I didn't feel much because my wife was helping me and all that, so I could take it. But my wife, now I'm shattered because it is too much, both of us, and she can't even move.
And you need to get you and her both properly reassessed. And if there's anything we can do, obviously let us know. We'll try our best. So let's just get these out. Okay, that's it all done. You can get yourself dressed again. It'll feel a wee bit stiff, but hopefully then you'll get a little bit of relief. Particularly these ones will feel a bit stiff. Okay? But let's see how you get on, and then we'll get you in again. Now, I can book you in next week for the sort of the same time. Is that too early for you?
It is, because, carer come, sometimes they come late as well.
Could you do 11:30 or 11:40?
Yeah. Hello? बंद नहीं कर रहा हूँ यहाँ से. She's quite worried, all the time. Because she rings me because she's not. I don't know what to do. It's not easy.
It certainly isn't, and you have to look after yourself, and then trying to look after your wife is difficult too. Are you looking after yourself now? Are you eating and stuff? Are you?
Yeah, not very well because sometimes you have to prioritize things.
You do, but don't let it go so that you don't look after yourself. Phone, keys. Look after yourself, Shahid. Not at all. Take care. I think that's everything of yours. I'll open the door for you. You're welcome. Oops. Okay, take care then, Shahid. Bye-bye.
How's Litland? How's your son?
He's 3 1/4.
Never.
Yep, and he's at nursery.
Oh, I can't believe it. Seems 5 minutes since you had him. Alison used to be a radiographer up at Wexham.
Hi.
Okay, so I'll just get... And you're sure you're happy for me to do it? Fab.
I'm sure you've seen thousands.
I've seen many. Okay, so, Alison, you're still having periods? Now we just need to do the nitty-gritty. Come behind the curtains, lovey. That's across your middle, OK? It's your modesty blanket. OK, get yourself ready. Let me know when you're...
Everything or...?
Just your knickers and your trousers, obviously, or take one leg out. So where are you working, Alison?
I have my own limited company.
Do you? How's that going?
This is my 9th week off.
Off?
Yep.
How come?
No agency work.
Oh, no.
Oh, yeah.
Oh, dear.
But yeah, they've offered me jobs in the Midlands, Southampton, Ireland.
Oh, gosh.
Leeds.
Yeah.
Everywhere but Slough.
OK, right, so I've got this. Right, Alison. Legs apart, love.
Every time I have to come here, I'm reminded of that joke.
Go on.
Where the mother...
I don't want to put this in while you're telling me a joke in case I laugh. Go on.
The mother, she was rushing to get out of the house and she picked up a cloth and, she just did a quick 1-2. And when it turns out she went to the, the GP to do whatever needed to be done, she said, was it okay? He said, yeah, but I like the fact that you've specially prepared yourself with glitter. She'd picked up a cloth that her daughter had been using and put glitter all over it.
Pretty.
She just...
There's no glitter down here, love.
No, there isn't any glitter.
OK, right, this is my hand, OK? I've got a little bit of gel on the speculum. Right, I'm in, and I'm just going to open it a little bit because I'm looking for your cervix, which I can see. OK, bear with me. OK, it's pointing a bit down. I'm just going to get the sample. OK, I've finished. All done, lovey.
Okay.
Paper towel here.
Thank you.
That's OK. Fab, you are done and dusted, Alison. OK, you're welcome.
And I might see you again.
Take care. All right, then. Hope the work picks up for you. Bye-bye. Bye.
Well, basically what happened yesterday at work, I had massive pain of my shoulder. I could not lift anything. I did have it dislocated, like twice, like badly. and it's like... keep
So
on
what do you do
coming.
as your job?
I work in a warehouse.
Okay, so you're doing heavy lifting, or what are you lifting?
Plaster boards or some bags of something.
So have you ever had a fall on your shoulder, or you have? When did
Yeah.
this happen?
Like 4.
4 years ago. What did you do? Tell me what happened.
Well, I was on paintballing. It was, it was
Paintballing?
wet. Yeah. Yeah.
And tell me what happened.
It was really, really wet. I was like running, and basically what I did, well, I sort of make a backflip, and I landed on my shoulder.
You have to be careful, don't you, Bartos? Okay, so that was 4 years ago. Show me which part of the shoulder it's hurting, or pop your tops up. So show me which part of your
So
shoulder is
basically
hurting.
that like hurts. Literally that around.
That area, okay. So what we need to do, I need to examine you, okay?
Yeah.
So let's start from the beginning. Okay, arms to the side as far as you can go. So that's very good. So show me which area, this area is hurting. Okay.
That's basically the area.
Let's have a feel. Okay, just go to the front. Let's have a feel. And finally, let's just check your neck. Just move to the left and right. Look up, look down. That's all fine. Yeah, that's brilliant. Okay, take a seat. So from examining you, Bartos, there's nothing nasty going on at the moment.
Yeah, I know, like...
Yeah, I don't think you've fractured it, but I think it could be a ligament problem. I think sometimes, like from the previous injuries you've had, the fact that you do a heavy lifting job, we have that a ball and socket joint is the shoulder joint, and there are these 5 small ligaments that go around it, and it allows you to move the shoulder quite well, but the problem is it can dislocate easily. I think what we need to do is let's get an X-ray, and then if this carries on, we need to refer you to the specialist, okay, in the hospital, okay?
Okay.
All right, then. So I'll probably see you in a couple of weeks. Get the X-ray done this week, and then come back next week for the results. All right, take care, Bartos.
Thank you.
Bye.
Last Saturday, I collapsed twice at home. Now, I believe this is an ongoing problem with my blood pressure, which is running low.
Okay.
Now, for the most part, when I fall over,
Yeah.
and I do go down like, you know, because I weigh about 15 stone, you go down hard.
Yeah.
This time I cracked into some furniture and I've hurt my ribs
Oh, gosh.
around here in a big way.
Right, okay, we'll definitely have a look at those.
And that's why I'm having trouble breathing, I'm having trouble laying down, I daren't cough.
Yeah. How long have you been having these episodes for?
On and off for months.
Months,
On and off.
okay. So
I mean,
certainly before
the
you started
doctor,
this...
My normal doctor's Lama.
Yep.
They keep trying to juggle around my medication.
Right.
Every so often, it's not every week, but every so often I just black out.
Okay,
And it was twice on Saturday. Once I went over in the lounge, and that's where I crashed into some furniture. The other time, a little while later, I was in the kitchen, and bang, I was straight on the floor.
Been a while since I've seen you.
Getting older.
Yeah, okay. But generally all right.
Can you give us help me to make you 21?
If I did, then I wouldn't be here. I'd be a rich man. I'd be sitting on a beach somewhere. Well done, you. Can I have a look at your card?
You're going to show the doctor?
You going to show me?
Done.
No. You're getting all shy now.
That's silly.
So, you've been trying to help your mum cleaning? Huh? Let's have a listen to your chest.
Should be a wheeze on the left upper side.
Very accurate. I've never had a patient tell me where to expect the wheeze. Who lives with you at home?
No one.
Nobody.
I'm on my own, you see. And it's getting more and more of a problem now.
So, your blood pressure's a bit all over the place today. Having looked at your previous results, so they've always been very, very well controlled, actually, your blood pressure.
It was last time.
Yeah, but there is still a bit of a drop when you stand up. Postural hypotension is a condition where the blood pressure suddenly drops very low when you go from a seating to a standing position. Low blood pressure can be just as harmful as high blood pressure, not necessarily in terms of the long-term health consequences, but particularly in the elderly groups, we worry about low blood pressure because it can lead to falls. Can I just have a listen to your heart? And just show me the area that your ribs are hurting.
Yeah.
Just here.
When I was walking yesterday, it felt like...
Just let me have a press.
Yeah.
Just there.
Yeah. it felt like my lung was pinching on the bottom of the rib cage. So I didn't know whether I cracked my ribs or possibly broken something, I don't know.
There's two things I think we need to discuss. Number one, for the ribs, I think you've bruised them.
Yeah.
And we're probably able to give you something to help with the pain in the interim.
I'll be honest, how does that interfere with I do drink.
Yeah.
I'm not alcohol dependent. I just drink to
Okay.
enjoy.
Well, listen, I mean, I
See
think
what I mean? So I've got to be careful.
Absolutely.
With some medications that don't mix.
The choice is yours. If you're not keen to have the medication, that's fine. There's not an absolute reason why you shouldn't have a medication, but obviously you need to be careful with your drinking once you're taking these tablets. Yeah. Would you like me to prescribe you them?
Yeah.
Okay. As far as your blackouts are concerned, I think it definitely does need more investigation, and the clinic that you're going to is exactly the right place to be. Mr. Jones was referred to a specialist clinic where they investigate patients who have been having episodes of blacking out. Often investigations will include something like a 24-hour heart monitor, and once they've found the cause, they can offer the appropriate treatment. When you had these episodes the other day, did you have any chest pain or shortness of breath when you fell?
No.
That doesn't happen. So you just, one thing you know you're alert and you're awake, next thing you're on the floor.
Bang, you go down.
Yeah.
Okay, so.
Hopefully on Thursday they'll get the investigation sorted.
Okay.
All right.
That's obliged.
Take care of yourself.
Thank you.
See ya.
Bye-bye.
Oh.
Just about to have his jabs.
Oh dear.
Yeah, I know.
We need to find his appointment, don't we? You could be on the wrong day. I've got Wednesday at 10:30.
What day is today?
Tuesday.
Oh my God, it's the second, isn't it?
Sunday appointment.
It's my fault, baby brain, isn't it? So it's tomorrow.
Yeah.
I'm Dr. Bolger. Hi. Am I doing an 8-week check by any chance?
Yes. Yeah.
Congratulations. Who's this?
It's Navraj.
Hello. Looking absolutely enthralled with something. He was a section, I gather, yeah?
Yes.
Why was that?
Because they said my bone, pelvic,
Right, difficult pushing through.
Yeah.
Right, okay. Scars okay? Because I think we saw you, didn't we?
Okay, yes, but I've got a little bit, like I get a leak.
From where?
From the stitches. So I think there's a tiny little hole that's open.
Let's have a look at that. Come across. Up onto the couch. And you're breastfeeding or bottle?
I am breastfeeding as well.
Breastfeeding, good.
It's a really funny smell as well. So there's like blood and a little bit of pus.
There is a tiny little, like you say, a little bit where it's not completely together, but it's absolutely tiny. It's a tiny bit wet this morning. Right, come back across. Let's send the swab off, yeah? And then let's see if we do need to give you any antibiotics for that. There's no suggestion that scar's breaking down, OK? There's a tiny little gap there. And what I'd expect it to do is heal from the bottom upwards. You obviously keep an eye on it. When the swab comes back, if we do need to give you antibiotics, then we'll know exactly what are the right ones to give you. OK? Birth control, do you need us to prescribe anything?
I actually haven't thought about what I want to do yet.
Have a think. What we can't give you at the moment is anything with oestrogen in it, OK? So the pill that you take for 21 days and a week off, while you're breastfeeding, you can't have that. But the other things are fine. It's just something we want to mention at this stage so that you're aware of it. Yep.
Hello. 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 Hi, can I help?
I left the glasses in the doctor's room.
Oh no, that was silly, wasn't it?
Not first, not last time, madam.
No.
I've already been in to see the doctor. I've got an appointment tomorrow with the job centre, and he's told me that when I get home to phone them up, right? But I've explained to him that job centre people, they always need proof of this, proof of that.
Yeah. Who's next, please?
Come in. Take a seat. How can I help?
I'm ill. Nighttime coughing very much, sometimes block me to breathe, and pain too much over here.
How long for?
It started about 2 days ago.
2 days ago.
Yeah, I was drinking the lamp seed there.
Yeah.
And plus there I've got the liquid for all-in-one lamp seed as well.
Okay. You smoke?
Yeah, nothing from 3 days.
Okay. Any problems with your chest in the past?
No.
Nothing at all?
No.
Can I have a listen to your chest?
Of course.
If you stand up for me. Do you want to come over here and just show me your throat? Just lean forward a bit, that's it. Have you had chest infections in the past?
No.
When you cough, you bring anything up?
Sometimes, not all the time.
And how much do you normally smoke?
Oh, it's about 10 cigarettes a day.
Okay. There's the odd noise on one side of your chest. I'm going to give you antibiotics, okay? It's not 100% sure that it's a chest infection, but there's enough here for me to justify doing it. Are you okay with penicillin?
Yeah, I think so, yeah.
Okay, take it easy and give up smoking. Yeah? Otherwise, you will get more of these for the rest of your life. Yeah? Do it slowly but surely. 10 a day for a week, 9 a day for a week, 8 a day. Get down to about 4 or 5, and then to look at yourself and go, do you want to live longer?
Okay.
Yeah? It's as simple as that, really. You need to confront it. You can try all of the patches and everything else. They can help, but fundamentally, it's
in the brain, I know.
yeah, you've got to want it.
So,
there you go.
thank you very much.
Okay.
Thank you, thank you.
See you later. Bye-bye.
Hiya.
Came in for my prescription yesterday, said it'd be ready this morning.
McGraw, isn't it?
Very good.
I'm learning.
You're not an ex-wife of mine, are you? How does she remember my name?
Oh, you see, she remembers the good patients.
Well, probably, yeah.
So the man himself. Hello, gorgeous. Hello. Do you think it might be worth a little smile? Yes, absolutely. So, start at the top and work down. Soft spot there, which is normal, that's fine. Baby's born with 2, and the back corner's closed up, which is normal at this age. No lumps or bumps you're concerned about?
I haven't actually.
You haven't noticed? Want to sit up for me? That's really not bad head control, is it?
Oh, he's been controlling
I think
his head
that's
since
really rather
day
good.
one.
Let's drop you back very carefully. And he still startles, which is normal at that age. What do you think? Okay, sweetheart.
Like head.
Do you not like that? Goodness!
Put the hat on.
You don't like hats? You're not going to be a hat baby? Poor soul. Oh. Right, I'm going to make your mummy put that nappy on because we're dicing with death here, really, aren't we? That is a completely normal examination, OK? Everything there that should be, everything doing everything it should. Lovely. So, he is fit for his immunisations. That's what will go off. We'll let you know if there's any problem.
Yeah.
You'll have a think about what you want to do for birth control. You'll keep an eye on the scar if you're concerned. You'll call us again, OK?
Sure.
Great.
Thank you for your time.
It's no problem. He's lovely.
Later.
Take care. Bye-bye.
We have pen thieves around here, don't we?
We do.
And they're usually called the doctors.
I had a nice blue and white one, just put it down, went somewhere and it's gone. Never found it.
I used to put it in my hair like that.
Yeah.
And then the doctors... So now I hold it and don't let them have
Stick
it.
it under the bra between the... Get your hand slapped. Yeah, definitely.
Come on, grab a seat. Ooh, you're wrapped up well. It's cold out there, isn't it? Right, what can we do then for you?
There's a few things for me.
Okay, let's see how many we can get through then in the 10 minutes.
Okay.
Right, start with the most important.
The most important thing that I'm worried about is that since 2 weeks ago,
Yeah.
I've been going to sleep and my pillow has been full of blood
Okay.
from my mouth. 2 weeks ago wasn't so bad, but now it's getting worse. Where I have to put a towel.
Are you sure it's your mouth?
It's my mouth, yeah.
Not your nose or your ear?
No.
Are you sleeping all right at night?
Yeah, well, get in the middle of the night, I'm like feeding little man. So.
Yeah, okay. And what's the other thing then? Anything else?
I'm feeling. Sometimes I feel like I'm anxious.
Yeah.
I when I'm in the car, like if I've got to do something, I get really like agitated, like really like panicky for no reason. I like my mood just changes. Like next minute I could be all like bubbly, and the next minute I'm having like a come down and I'm like taking it out on people. Like I'm just going crazy to be.
I think. Well, I don't think you're going crazy, but I do think you're under quite a lot of stress.
I'm just feeling like I don't know. I just need something just to calm me down.
Okay.
Do you know what I mean? And I don't usually do that. I'm very old school. I usually just get on with it.
Yeah.
But now it's getting to the point where I need some sort of help.
Right.
Wow, you brought your bike.
If you're driving, then make sure you have glasses.
I'll use them.
All right, okay.
So how are you been?
Well, pretty lousy at the moment. I've got a chest infection, aeroplanitis.
I'm a terrible traveller. Don't like flying, so I've decided I'm not going anywhere.
Do you feel sick on?
I hate it. I hate flying. I went to America and I hated every single minute of the flight. I just wouldn't move. My hands were just like... I hated
Oh, bless you.
Often people, when they feel like this, feel sometimes that life's not worth living. Have you felt like that at all? Have you done anything about it?
The thing is, I felt like that when I had my first daughter. She's 11 now. I felt like I just wanted to give up, basically. And there's no reason for me to feel like that, if you know what I mean? But
What would stop you doing anything like that?
my kids.
Yeah, good. And remember that, so it's always...
I keep thinking about my kids.
Yeah. Let me just look in your mouth to see if there's anything I can see first, and then we'll talk about the other. Okay. Just open wide. That's fine. And then, this is a bit awful, but I'm just going to stick out your nose and have a look, sorry. Okay, that's fine. I mean, that all looks fine. I can't see anything in your mouth, but then I can't do a proper exam. You might want to sort of see a dentist about getting the proper exam of your mouth done. What I am worried about is obviously you're feeling very tired, you're a bit low, and you're sort of very down. I'm going to just ask that we do some blood tests. And some of the blood tests will look at see whether you're clotting and the blood is all sort of clotting right to make sure there's no problem with your blood system, if you like. But
I
having
haven't
said,
got cancer, have I?
I don't think you've got cancer. But one of the markers we do is a marker of general inflammation, which
That's what
helps
I'm
us.
stressing.
But that helps us rule out things like cancer.
Okay.
Okay. But I think it's important to see the dentist ASAP, and you'll get free dental treatment because you've been, pregnant in the last year. I do think you need a little bit of help, and I think, it might be worth looking at getting some talking therapies where they'll sort of speak to you and help you with that. Maybe getting to the stage where you need to take something to help feel a little bit better, a little calm down. Now, we can wait and see if talking therapies help, or you can sort of start that and do the talking therapies as well.
Can I just can you?
I can give you something to take if that's fair.
I just want to just...
Feel a bit calmer.
Yeah.
Okay.
I don't want to be...
Yeah. What I'll do is, because you're low, I will give you one of the antidepressants that we use to lift the mood, but it also is used for people who are just generally very anxious.
Obviously, now I'm being busy.
You're a little better, do you think?
A
or
little bit better, but the mood is like I just start getting all angry for no reason and just...
Okay.
Like I said, it's probably a big change.
I think it's, you've got a lot of stress and, the bleeding and stuff. It may be that you're just biting your tongue or biting your cheek, and that's why it's come from. If it was something that was there all the time, I'd be much more worried about things like anything cancerous. Okay. But as I said, some of the bloods will help us decide whether that is the case. And if you ask at reception, you try and see if we can book you in for that, and also ask them for the talking therapies number as well, because they have it. Okay? There's a lot to remember, but the dental thing is important. Okay.
Thank you very much.
You're very welcome. Take care.
Thank you.
Look after yourself. Now, if you're struggling, come back sooner.
I will.
Okay?
Thank you very much.
Bye-bye.
I've got a headache. I want a Dr. Cuddle.
No, you can't have a Dr. Cuddle.
I've got a cuddle off Dr.
Call Dr. Ward.
I did.
Apparently, if you feel unwell, you've got a headache, a Dr. Cuddle makes it go away. So she literally
had a cuddle.
Dr. Ward. You need to do that, don't you?
Here we come. Come and take a seat.
Keely said, hello, Claudette, us again. It's like the family's day out every week. But sit down, sit there, you sit over there.
Right, so your asthma's playing up, right? Sounds like a frog.
Dr. Ward, she has had this so long, we just don't know what to do. Last year, she was really, really ill. She lost so much time off school because they sent her home as well. We were sending her.
Yeah.
And they can't have her because it's disrupting the class. But it's upsetting her.
Sure. The problem you get is that we can't prevent bugs from coming along.
Yeah, because her immune system, I think, is low.
Well, it's not even that, is it? You know, she's got an underlying chest thing.
So damp.
You don't catch them from the house. You get them from other people at school.
Is it?
Yeah. Have a stand up for me. I need to listen to your back, yes?
Stand up, babe.
OK, the problem is that coughs always sound bad.
Yeah.
OK, and it's not the coughing. It's not the coughing that we worry about. It's what the breathing is like when they're not coughing. Yeah. OK, so at the moment, let's take that off, can we? OK, deep breaths through your mouth.
Listen to her chest.
OK, good. That'll do it.
Do you think it's... They said she had croup up every time we take her.
Yeah, that sounds like croup to me.
Yeah, and we said only babies get croup.
No,
they said
it's a variable feast. You can get it. And I think it is croup because if you listen to it, it sounds like a... Yeah, it's like a seal barking, isn't it?
Yeah.
The good news is the chest is really clear.
So that's good.
OK, it is. So what I worry about asthma is when the reaction to the bug that comes along affects the breathing to the point where you really wheeze, you've got a tight chest, so you're going, you know, and you can tell by the breathing. So the breathing at the moment is really good, OK? This is all up here at the moment, OK? This is all... And it's related, it's around the vocal cords, which is why you get that strange sound. So drinking fluids is important, paracetamol for fevers or temperatures, OK?
Yeah.
And that's what she needs.
Stick to her medication that
and
she's
really
got.
stick to what's going on there.
Listen to this. Sometimes she don't take it, and we really go on like her.
Her chest is good though at the moment. Okay, so those inhalers are doing what they need to. They can't do anything about the croup. That croup is there until the immune system gets in.
Because last year, obviously, it was such a worry. She was so ill.
See how she goes. If her breathing starts getting worse, then we must see her. Okay.
Yeah. What about if I got her some cough lincers?
Makes no difference whatsoever. Waste of money.
She steamed herself this morning in the
Steaming is good.
bar.
Steaming is good.
Did you feel better after that?
It'll help a little bit. It's just there to
She's
aid.
very good at doing her stuff and that.
Good on her.
Just worry in case, you know, make sure before it takes her home. What do you say, Keely? Thank you, Dr. Ward.
Bye-bye.
Say bye, Reese.
See you, Reese.
Bye. So, Keely, you must carry on with your medication and you have got croup.
Bye-bye.
Thanks, bye-bye.
That's for you.
Thank you.
No problem. Bye-bye.
Bye.
There you go, Maureen.
Thanks a lot, lovely.
Have a nice weekend.
Yeah, sure I will.
Take it easy.
Thank you.
See you later.
Bye.
Are you planning an overdose at the moment?
You're going to think like that.
Yeah, but the thing is, you don't really like the idea of someone stabbing you through the arm.
Not really, but you'll be fine.
When I went to the toilet, there was blood and a blood clot.
Right, OK.
My semen is pure red as well.